Normally, when it comes to sex, being responsible is key. But otherwise, anything goes as long as it's fun for both and feels good. But what's the situation if someone is currently undergoing cancer treatment? Does the same still apply? Yeah. Or are there certain things you should keep in mind or maybe even avoid altogether? That's exactly what we're going to clear up in this video. So, let's start with the most basic question. Are you allowed to have sex during cancer treatment? In short, yes, of course. Yes, but, and this is important, you should be a bit more careful than usual for several reasons. The main reason is that during cancer treatment, the immune system is weakened. This means the body can't fight off infections as well as it normally would. So don't forget to wash your hands and always use a condom. Even if you normally use other forms of contraception, condoms don't just protect against pregnancy, you see, but also against pathogens that can be transmitted during intercourse. However, only what's already there can be transmitted. So if you really want to be on the safe side, get tested for sexually transmitted diseases. During cancer treatment, the person affected is regularly examined and tested anyway. The other person can, for example, have a test done at a general practitioner's office. It's really quick to do, and it provides peace of mind. And that's for both partners. Now, you might be wondering, if we've both been tested, do we even need to use protection? Why can't we just skip the condoms altogether? The answer here is a definite no. Because cancer treatment is not a substitute for contraception. Pregnancy can still occur. Even though the therapy can damage sperm or egg cells, you can still get pregnant. And the thing is, the risk of the child not being born healthy or not being able to be carried to term is many times higher. So you should definitely take that seriously. Because of course, for girls and young women, pregnancy during cancer treatment is an additional strain on the body. And if you really want to have a child as soon as possible after cancer treatment, the rule is to wait at least 2 years after the end of treatment, before you try to get pregnant. This ensures that everything is fine health-wise, and there's no increased risk of miscarriage or birth defects. What else do you need to consider? During chemotherapy, traces of the medication can also be found in semen or vaginal secretions. These residues are so small that they aren't dangerous in the usual sense, but they can irritate your partner's mucous membranes. Here too, you're on the safe side with a condom. At the same time, some cancer treatments can also cause your own skin to become more sensitive and mucous membranes to be irritated. In girls, it can happen that the vaginal mucous membranes become less moist, and this can make sex not only uncomfortable or even painful, but also increases the risk of injuries and infections. It's best to use a lubricant then. They're available at drugstores or pharmacies. But make sure the lubricant is unscented and also water-soluble so that it's compatible with condoms. Another option could be estrogen-containing ointments that your gynecologist can prescribe. These ointments promote blood circulation and ensure that a protective film forms on the mucous membrane. And what you should also keep in mind, especially during intensive chemotherapy, the risk of infection is particularly high. Therefore, it's advisable to avoid sexual practices where the mucous membranes are heavily irritated, such as anal or oral sex. Because small tears or injuries can occur, through which pathogens can more easily enter the body. So just take it a bit easier. Yeah, and by the way, kissing, stroking, or masturbation are things you don't have to give up at all during cancer therapy. Yes, that's all possible without any problems. And who knows, maybe you can use this situation to rediscover yourselves in a different way.